camera slowly pushes in as the faces of Connie Mendenhall, Leland Smith, and Luis Gutierrez come into focus. Kimberly Cavalier, Human Sciences Specialist.
Anyone and everyone can help somebody who's experiencing a mental health challenge.
David Brown, Behavioral Health State Specialist.
In Iowa, we know that 57% of Iowa's communities are in a mental health shortage. That means they have difficulty accessing a mental health professional. In fact, in Iowa, we're 45th in the nation, including District of Columbia, as far as mental health providers per capita.
Kimberly Cavalier is seen presenting the mental health first aid training at the Iowa Department for the Blind. Employees are shown listening and contributing to discussion.
Well, we know that mental health first aid really focuses on helping individuals to seek out mental health care before it becomes a crisis.
They say that 1 in 15 individuals needs to have mental health first aid training to reach everyone. By providing mental health first aid training to organizations like the Department for the Blind, we are putting in the hands of these people the knowledge that they need to be that change, to be that driving force in helping people get the mental health help that they need.
Connie Mendenhall, Chief Information Officer, Iowa Department for the Blind.
Outwardly, there's all kinds of, you can pick a million identifiers for a person. But what you should be aware of is the person themselves.
Camera tracks past a sign on a brick building that reads Iowa Department for the Blind. The building is shown from a low, wide angle as the camera tracks backwards. Leland Smith, IMC Librarian, Iowa Department for the Blind.
Mental health affects everyone equally. It's no more prevalent in the blind community versus any other demographic.
Footage of the mental health first aid training at the Iowa Department for the Blind. Multiple employees are participating and sharing in the training.
As we're all people and we all experience and we have the same feelings and same struggles, some may need more assistance than others.
It covers every aspect of mental health awareness. It covers it in a way that is in-depth but is not shocking. It covers it in a way that's not overly traumatic for people.
Luis Gutierrez, Center Tech Instructor, Iowa Department for the Blind.
We're not all going to know what each other are going through, but to have framework for how to approach something and support somebody who's going through something that you may not fully understand and comprehend.
Students at the Iowa Department for the Blind are seen drilling in a wood shop, cooking food, and using a braille reader.
We encounter people in our lives who face these barriers and have these challenges in their lifetime that we could help address and help walk them through and point them towards the right resources if we know of the resources. And that's part of the training, is developing the understanding of where to turn, what's out there, what's available.
Footage of the mental health first aid training at the Iowa Department for the Blind.
Many of us are not confident or not trained well enough or fearful as far as engaging someone who may be experiencing some type of challenge. So it's so important for Iowans to be able to and be willing to engage those who may be struggling so they can get the best help possible and in the soonest fashion.
The stigma associated with mental health is something that we're trying to get rid of, and we want everybody to feel that they can have open, honest conversations about mental health. And I truly believe that mental health first aid and trainings like this will make all Iowans know that it's okay to have open, honest discussions about their mental health.
Animation of Iowa State University Extension and Outreach wordmark. Text appears below. This institution is an equal opportunity provider. For the full non-discrimination or accommodation inquiries, go to www.extension.iastate.edu/diversity/EXT.